If you think back to April 2020, there was a lot of concern that returning Canadians would be bringing COVID-19 back with them. So there was a real desire amongst public health officials to know who was coming back, to make sure that they understood the need to self-isolate, and during their self-isolation to make sure that they had all the information and supports that they needed.
This project, the COVID-19 response and the Returning Travelers Program, there were many facets to the project, but the role for Service BC was to support citizens when they returned from traveling internationally. And what my team members were doing were making calls to the returning travelers to ensure that they understood sort of what was needed of them through the process.
Perfect. Well, I'm so glad you've already got that done. You're doing everything right.
So if we had, for example, a senior that was returning and needed support around, didn't know how to get their prescription. So we would support them by making referrals to the community to ensure they had what they needed so they could remain self-isolated in their homes.
In the early days when we first started, our first real task was really to bolster our incident command structure. So the ministry uses an incident command system, for instance, in our BC Wildfire Service to address those kind of natural hazard disasters.
Sure, we'll take that.
Once we had sort of the basic team in place, really was how we were going to staff the borders and YVR itself. And it was decided that we would use our natural resource officers within our ministry and the conservation officers within the Ministry of Environment to staff the actual borders.
On site at YVR, we were fortunate to work with some great partners in rolling out this checkpoint. So at the start, coordinating with the Canadian Border Services and then YVR as well. And we touched on YVR's expertise in particular around trying to set up our queuing systems and that, and funnel people through most efficiently. So they were a great support at the beginning when we tried to set up our process. And then over time, with the federal government coming on board with their own checkpoint, coordinations with the Public Health Agency of Canada as well.
This was one of the first real demonstrations during the pandemic of just how much can be accomplished by ministries and other partners in support of public health goals. Ministries and other partners and agencies really have been able to implement and support the objectives that the public health officer has set out. So I think this was an early example of that.
I really think this has had a huge impact for the people that we serve, especially when people are experiencing such a health emergency where they're worried about their families. We made huge shifts around moving to self-service because we needed to do that to keep the public safe as well as our staff. I think our whole model of service is going to shift for the better because of this process and how we moved through and supported the pandemic.